trajectory for all that follows. I invite Dr. Uma to speak on the topic Primary Healthcare, the Liftoff.
Sri Sai Ram. My humble pranams at the lotus feet of Bhagwan Baba. Esteemed trustees, respected elders, and my dear colleagues, we are all gathered here today to commemorate 100 years of the Sai Avatar and 70 years of free medical service to humanity. It is my pleasant duty today to take you to the genesis or takeoff of this medical mission, as it all started with laying the foundation of Sri Sathya Sai General Hospital way back in 1954. Ostensibly, it began with the fulfillment of the promise made to Mother Ishwaramma by Bhagwan that a small hospital be started in the village of Puttaparthi. As you can see, the Puttaparthi of 1950s was rustic and remote. And yet the avatar chose this hamlet from which to demonstrate to the world that two principles of Sanatana Dharma, Janani Janma Bhumischa Swargadapi Gariyasi, the mother and motherland are holier than heaven itself, and that Vidya and Vaidya should not be commercialized. Let me take you through a pictorial journey of the milestones of General Hospital. The foundation was laid by the divine hands on November 23rd, 1954. The hospital, a one-story building, was built entirely by the devotees with their own hands. Vikkina Sita Ramaya Garu was the first medical superintendent. This photo was taken by Bhagwan himself. He was the cameraman. In October 4th, 1956, Swami inaugurated the hospital. This hospital grew organically along with the organization. A mobile medical service was started in the 1960s. This went to the nearby villages. In 1970s, as multitudes began arriving to Puttaparthi, the hospital doctors used to hold medical camps in the Purnachandra Auditorium. This practice continues to date, with medical camps being conducted by Sri Sathya Sai organizations, both India and overseas. In 1984, the main building as it stands today, housing the OT complex and the maternity wing, was built. In 1990 came the extension block with the starting of the super specialty hospital. An NICU was added in 2007, and the new extension block was built in 2015, which currently houses the emergency and the general medicine departments. The small hospital, as everybody said, which started with 8 beds, has grown into a 120-bedded facility. The number of patients who come here speaks volumes about the work done. We see approximately 1,000 patients daily in the OPD. That translates to an annual number of almost 3 lakhs, and almost 16,000 patients get admitted here annually. An overview of the scope of the services that are offered at General Hospital. The obstetrics and gynecology department is truly the bedrock of this hospital. It is not an exaggeration to say that almost every person born in the last 50 years in Puttaparthi and surrounding villages has entered the world in the labor room of General Hospital. We see 30,000 patient visits per year, 1,400 deliveries per year. That's an average of almost 4 per day. It is ably supported by level 2B NICU. We have a pediatrics department with 120 children coming every day. It's a baby-friendly hospital. end-to-end care for type 1 diabetes, including giving insulin, glucometers, lancet, sick day management, everything is done here. The Department of General Medicine, it is the backbone of this hospital. It sees nearly 500 patients every day. Chronic diseases like diabetes, hypertension, COPD, bronchial asthma, CAD, end-to-end consultation, medication, inpatient care, emergency care, everything is provided here from cradle to grave. The emergency department, 24-hour service, nearly 70 footfall per day, which is almost equal to some of the smaller medical college hospitals. We are a referral center for snake bites in this district. We see almost 300 to 400 patients with snake bites per year. We use more than 3,000 vials of ASV. And surprisingly, we are the only region here which has immunoglobulin for rabies. It is ably supported by dietary, laboratory services, pharmacy. The dental department takes care of the dental needs of this entire community, almost 22,000 patients per year. Orthodontic treatment of the growing children of the Sathya Sai organizations is also done here. We also have a general surgery, anesthesia, ophthalmology, ENT, audiology, and many ancillary departments. We have a department of yoga and lifestyle disease clinic, which focuses on health education and preventive care. This hospital is accredited for 2 seats for family medicine. It started in 2008 and it has a 100% pass rate. Our students will testify that they receive a sound clinical training enriched by patient care delivered both inpatient, outpatient, and emergency. They also have a spiritual atmosphere, and it has turned them into competent, confident, and compassionate doctors. The financial impact of this hospital is huge. The market value of the services we render is more than 24 crores. And this is a very conservative estimate. We have taken only some of the expenses into account. This has worked out as reduced out-of-pocket patient expenditure in this community. And that has saved countless families from debt and poverty. It has increased the financial stability of this community, and it has led to better health outcomes. A survey was conducted by the students of Sri Sathya Sai Institute of Higher Learning in our hospital recently. The sample size was about 435, and they measured patient satisfaction on a scale of 1 to 5 in every category, from accessibility, convenience, time spent with patient, interpersonal manner of the doctor, technical quality. The hospital has scored 4.7 to 4.9. The intangible spiritual impact. The same survey showed that the reason the patients chose to come to this hospital was not merely because it was free or convenient, but also because of the reputation of this hospital or the faith they have in Bhagwan Baba. As Swami has said, patients who come to this Arogya Nilaya will be restored to health and develop gratitude in their heart and go to Anand Nilaya, there equipped with faith that will guard them against further illness. Dawa bhi or dua bhi. Some of the unique features of General Hospital are being the very first hospital, it had hand holding by the Avatar himself. We enjoyed the physical proximity of the Avatar. There are days when Swami has sat and consulted on patients in General Hospital. Sai Dhanvantri has sat in the dispensary and dispensed medicine in this hospital. We have a workforce of dedicated doctors and nurses, silent workers for whom seva is not a pastime, it is a way of life. They have worked for decades, silently, without any remuneration, motivated solely by devotion and love. It is truly a unique work environment, free of competition, comparison, and rat race for pays. Truly, our students say it is a place with zero toxicity. Our visiting doctors of international repute come from all specialties, dermatology, ophthalmology, endocrinology, psychiatry. They offer their expert services to our patients and they enrich us with their knowledge. The Sevadals, the silent army of Swami. They come every fortnight from all parts of India and they take care of the entire housekeeping needs of this hospital. Finally, I would like to say in conclusion that what Seva does to us is far more important than what we do as Seva. Truly, for the people who work here, the workplace is a workshop where the maladies born from Maya are cured by the divine doctor. For us, this is a sanctuary where spirituality and medicine have met. With gratitude in my heart and on behalf of the entire General Hospital family, I thank the Lord for this opportunity to serve in his hospital. Jai Sai Ram.
Thank you, Dr. Uma, for your insights into the earliest and the most critical level of care and for highlighting how this sacred mission took off. Your talk reminds us that every small step in service can uplift countless lives. Before we move on to the next speaker, a couple of housekeeping guidelines. Food and beverages are not permitted inside the auditorium. Kindly finish refreshments before entering. Please exit quietly only for genuine needs such as visiting the restroom or getting water, maybe not for checking WhatsApp or scrolling Instagram. Restrooms are located opposite every exit and water dispensers are placed in the side corridors. Should you need any help, our volunteers will be happy to assist you. Kindly refrain from taking photos or videos during the sessions. The Sri Sathya Sai Media Center will capture and share official photos and recordings post-conference. If you wish to take pictures for personal memories, please do so before, after, or between the sessions. Exhibition displays. Don't miss the digital displays at the rear end of the auditorium and in the lobbies, which showcase the remarkable work done under Sri Sathya Sai Central Trust and Sri Sathya Sai Seva Organization and the Global Council. The Sri